The healthcare team. It's necessary for groups of people to work together to provide patients with all the services they need to maintain comprehensive health care. Good communication is an essential component of any healthcare team that provides care on a 24-hour basis. Communication includes written items such as medical record notes, flow sheets, and other formats that convey essential information. The healthcare team includes all nursing staff, personnel, physicians, and other professionals such as pharmacists, social workers, case managers, etc. A variety of other services might also be involved in a patient's care, such as physical, occupational, speech therapists, and psychologists, etc. The following is a list of some of the primary players in each nursing department, but by no means is this list all-inclusive. In the emergency department, you may have the emergency department physician that will direct the entire healthcare team in the ER setting. There may be emergency medical technicians, registered nurses, the ER doctor, X-ray technicians, radiologists, a family physician, orthopedic surgeons, lab personnel, and clergy. In OR, you have the anesthetist, who might be who is an RN, who has a BSN and has studied an additional 2 to 3 years in anesthesiology. A surgical technician often works with one surgeon or a group of surgeons and prepares the specialized equipment and sterile instruments according to the surgeon's preference. The anesthesiologist is a medical doctor that has specialty training in the delivery of anesthesia. Then you have PACU, or the post-anesthesia care unit, used to be known as the recovery room. Patients will usually stay in PACU for 2 to 6 hours until their vital signs are stabilized and their sedation levels decrease. You can have the PACU nurse, transport aide, and staff nurse. In ICU, the staffing ratio of the intensive care unit is usually 1 nurse for every 2 patients. Depending on a patient's status, the staffing ratio might even at times be 1 nurse for 1 patient or 1 nurse for 3 patients. You have RNs, the clerk receptionist, the medical records department, the pharmacist, respiratory therapy department, and the transport aide. On the surgical floor, with a discharge team, you may have a nurse manager, a team leader, the LPN, the physical therapist, the physical therapy assistant, social worker, patient care technologist, dietitian, housekeeper, the extended care unit, the physical therapist, the physical therapy assistant, nursing assistant, occupational therapist, the LPN, the day supervisor, and so on. But that kind of gives you an idea of the wide variety of people that it takes to run a unit. Maintenance of health or wellness is an important function of nursing. The direction of practical vocational nursing has been channeled by the definition that is listed here. It's also core in the WATC philosophy. The public is unclear as to the different types of nurses on the healthcare team. They think if you're a nurse, then you know everything about nursing, period. Members of the healthcare team generally, and nursing specifically, need to know about each other. Knowing and recognizing the role that each person plays in the healthcare team's duties and responsibilities really does help smooth out the bumps in patient care delivery. So there's a lot of diversity in the education of nurses. With a registered nurse, you can go through an associate degree program or an ADN, which is a balance between general education, nursing courses, and clinical experience. With a diploma program, this is general education, nursing courses, and then an emphasis is placed on the clinical experience. And the baccalaureate nursing program emphasizes liberal arts, sciences, and nursing theory along with clinical experiences. Graduates are prepared for administrative work. Regardless of the course of study, all nursing or RN graduates take the same NCLEX examination and receive the same license. All RNs function under the Nurse Practice Act of the state in which they are working. The RN is the one that plays a pivotal role within a complex healthcare environment by coordinating the patient's care. They coordinate the care with the nursing staff and all the ancillary staff members. They play an independent role. They initiate and carry out nursing activities with the ultimate responsibility for care given to the patients being placed on them. The interdependent role of the RN is carrying out the legal orders of another health professional and carrying out decisions about patient care that are made jointly by members of the healthcare team. It is the independent role in decision making that distinguishes the RN from the LPN. Postgraduate educational opportunities include going on to achieve that BSN completion program or advanced degree programs such as master's or a doctorate, but there's also certifications that are available. A nursing license ensures minimal entry competence, but a certificate is going to demonstrate advanced or specialized competence, and it's usually after a certain amount of work experience. Nurses that have master's degrees can be employed in a variety of settings, such as nursing schools, hospitals, and other settings, such as administrators or clinical specialists. Nurses that have doctorate degrees are usually involved with teaching and research, but some are actively involved in advanced clinical practice, usually within a large academic medical center. The LPN focuses on bedside clinical care, including the administration of medication. Critical thinking for the LPN is extremely important, and LPNs, as always, need to be aware of the Nurse Practice Act of the state in which they are employed. The majority of LPNs are employed in long-term care settings. In those types of settings, the patient acuity level is usually less complicated and intense. They can also be employed in physicians' offices, weight loss clinics, freestanding clinics, ambulatory care centers, home health care agencies, industry, dialysis centers, group homes, adult daycare centers, etc. But again, it's important to know the scope of practice, and if you have any questions, again, refer to the NPA. Other nursing personnel include student nurses. Student nurses, again, have a responsibility to give safe care and act under the instructor or other nurse supervision. And remember that as a student nurse, you are expected to provide care at the level for which you are studying. So if you are in the LPN nursing program, you are expected to provide care at the LPN level. If you're in the RN program, you're expected to provide care at the RN level. Nursing assistants training will include a minimum 75 hours of instruction with clinical practice, and a large number of nurse aides are employed by nursing homes. Currently, the supply of nursing assistants is not meeting the high demands of employers. Unlicensed assistive personnel are trained by healthcare organizations to function in an assistive role to RNs and LPNs. UAPs may also be known as nurse extenders, patient care technicians, assistive workers, or patient care associates. Some UAPs are also nursing assistants, but many are not. Clerk receptionists, where their job responsibility is mainly secretarial. They prepare, compile, and maintain patient records on a nursing unit. And a unit manager supervises and coordinates management functions for patient units. They're responsible for day-to-day operational issues such as supplies, staffing coordination, etc. Some nursing units may have both a nurse manager and a unit manager. If there is a unit manager, then the nurse manager is usually the one that's involved in the clinical care issues and more long-term planning. Some of these nursing care models may work well in a particular setting or situation, but they may not be well suited to others. You have the case method, which is one-on-one relationship with a patient. It occurs in intensive care or special care units. It can also be well suited to home care nursing. Functional nursing are tasks that have to be done for patients, and they're divided among the staff. They're based on the assembly line production concept and may result in fragmentation of care. Team nursing consists of small teams that are assigned to care for patients in each group. It's based on the belief that goals can be achieved through group action. Team nursing may be better suited for a nursing home facility. Primary nursing is Each primary nurse is a bedside nurse. They're characterized by responsibility and accountability. Functional nursing, if functional nursing was developed in World War II when there was a lack of RNs available, and this was the only way they were able to get work accomplished with the shortage of help. In nursing case management, this uses a varying ratio type of nurses based on patient needs, and it focuses on achieving patient outcomes within specified time frames. Patient-centered care improves the quality of care by using hospital resources more efficiently to meet patient needs. Patient-centered care moves the resources around the needs of a group of patients, which can include ancillary services such as having a physical therapist assigned to an orthopedic unit rather than having all of the patients transported to the physical therapy department. And the hidden nursing shortage. Employment of LPNs is expected to grow by 21% between 2008 and 2018. Even though the scope of practice of LPNs is more limited and they cannot replace or substitute RNs, they do contribute to the severe need for nursing manpower.